Hello. So today I'm going to talk to you about something that can complicate neutering in animals, and that's called cryptorchidism. So cryptorchidism is where one or both of their testicles don't make the journey into the scrotum itself. So when an animal is in utero, when they're born, their testicles are in their abdomen. They're actually kind of high up in their abdomen, not super far from where the ovary is going to be in a female animal. And sometime very early in their life, they descend into the scrotum. And the reason they live in that area is because the testicles and the sperm that are in the testicles don't like to live at the temperature inside the body. They prefer to be a couple of degrees cooler, so that's why they hang down. That's also why that part of the body has the ability to suck up or go down depending on the temperature outside. Now, the reason cryptorchidism is a challenge is there's two main areas that testicle could be. One is called the inguinal area, so that's kind of the area right above the scrotum that's in between it and the penis. That area makes things a little bit easier because you don't have to go searching for it. Usually you can feel it right there. Usually, not always. The other potential is in the abdomen. That's when things become a challenge. Because it can literally be anywhere in the abdomen. There are some typical places that it will be, but I have done surgery on plenty of cryptorchid neuters where it was not where it was supposed to be. It was somewhere else doing its own thing. And obviously that makes the surgery more intensive because you take a 10-minute neuter and make it a significantly longer and significantly more in-depth surgery because you're in the abdomen digging around. Now, you can get some weird things that make it more complicated. I have seen cats that only had one testicle. We thought it was a cryptorchid. There wasn't another one in there. I've seen a cat with 3 testicles. It had 2 in the scrotum and 1 in the abdomen. We only found out when it was still acting like a big bad man after it got neutered. And there are some weird genetic things that can come with it as well. Kind of the specific one that I can think of is schnauzers. If schnauzers are a unilateral or one-sided cryptorchid, that can be an indicator for a specific congenital disease, which could mean that the cryptorchid testicle is actually attached to a uterus. That's a whole nother thing to discuss. If you have an animal that is a cryptorchid, it is suggested for them to get neutered, because the testicle that's inside the body, if it's abdominal, has a significantly increased chance of becoming cancerous because it doesn't like to be that temperature. And it is suggested not to breed these dogs because cryptorchidism is genetic. I have encountered some breeders in the past that have requested that we only remove the cryptorchid testicle and leave the one that's descended so that they can still breed the dog. They still have sperm count and all of that to be bred. I personally will not do that because I know that they're spreading their genetics of cryptorchidism and it's just going to become someone else's problem down the line. But I have met veterinarians that are willing to do that. So if you want to do that, it's worth having a conversation. But I really don't know why would anyone would want to do that unless they have a championship level animal and they think the cryptorchidism was just a one-off. But yeah, if you have an animal that you're concerned about that, have your veterinarian do a check. It's normally a pretty easy little feel to see if they've both made the journey.